All right. Welcome in, everyone. We're diving into something pretty personal today, huh?
Yeah, this one hits close to home.
It really does. We're looking at 15 reasons we became healthcare advocates. And I got to say, this really is drawn from both of our journeys.
Oh, absolutely. I mean, it's like thinking back on all those moments that kind of pushed us to take charge, with healthcare decisions, both for ourselves and for our families.
For sure. And the thing is, I think a lot of people listening are probably in the same boat, wanting to really understand this whole healthcare world.
Yeah, it can be so overwhelming, right? I mean, trying to navigate all the ins and outs, the jargon, the system, it's a lot.
Yeah. And that's kind of what we're hoping to do with this deep dive is like give you a shortcut, to understanding, to grasping why it's so crucial to be proactive.
Exactly. Like we want to illuminate those key moments, those turning points where you realize, hey, I need to step up and really advocate for myself or for my loved ones.
And I think that's really our mission today, to explore, to understand those core motivations behind becoming a healthcare advocate.
Because at the end of the day, it's about having the knowledge, the confidence to navigate this complex world and really ensure you're getting the best possible care.
One of the first things that really struck me, and I think this resonates with a lot of people, is the whole jargon barrier,
Yeah.
the medical terminology.
Oh, tell me about it. It's like a whole different language sometimes.
It really is. And I remember, way back when my dad was diagnosed with diabetes, and it was like, whoa, this is a whole new vocabulary.
And it's not just about feeling a little lost. It's a real problem. I mean, the statistics are kind of shocking. Nearly 80% of patients say they've misunderstood some medical terminology at some point.
Wow, that's huge. That's a lot of people.
Yeah. And, it makes you realize that it's not just about a few confusing words here and there. It's a fundamental communication breakdown, right? Like, how can you make informed decisions if you don't fully understand what's being said?
Absolutely. And I think that's such a key takeaway. This widespread misunderstanding, it points to a bigger problem in how medical information is shared.
Totally. And it highlights the need for both sides, right? Patients need to feel empowered to ask questions, seek clarification, and doctors need to prioritize clear, concise communication.
And speaking of needing to be proactive, that kind of leads into our next big point, medical errors.
Oh gosh, yeah, that's a scary one, but so important to be aware of.
It is. And I remember hearing about a family friend who had a really bad experience with a medication mix-up, and it just made me realize how vital it is to be vigilant, to be checking everything.
And when you look at the numbers, it's really unsettling. The estimates for deaths due to medical errors in the US, they range from 44,000 to 98,000 every year.
That's a staggering range.
Yeah. It is. And it's not about pointing fingers or placing blame. It's about recognizing that the healthcare system, as amazing as it is also incredibly complex. There are so many moving parts, so many opportunities for things to slip through the cracks.
So what's the takeaway here? What do we do with that information?
I think the crucial point is that this potential for error, it underscores the importance of having multiple layers of oversight, right? Including an engaged patient or advocate who's asking questions, double checking things, being that extra set of eyes.
Yeah, that awareness, even though it can be kind of scary, it's often the push we need to get more involved, to be more proactive about our healthcare safety.
Absolutely. And, another factor that plays into all of this is the time constraint that healthcare professionals face.
Oh, for sure. I mean, you think about the average primary care visit, what is that, like 18 minutes?
Yeah, something like that,
Yeah.
which is not a lot of time to discuss everything, to really delve into complex issues.
It's not. And I know I've felt that rush before, like, okay, got to get in, got to get out, got to get to the next patient.
And it can make you feel like you have to be so focused, so prepared going into those appointments, right?
Absolutely. And that's why I think it's so smart what you were doing with your grandmother, creating that list of questions beforehand.
Yeah, that was a game changer. I realized I needed to be strategic with that limited time to make sure her concerns were really heard and addressed.
And I think that's a great takeaway for everyone listening. Think about how you can maximize that time with your doctor. How can you be organized, be prepared to make sure everything gets covered?
And speaking of being organized, that kind of segues into our next point, which is the need for coordinated care management.
Oh, yeah. Especially when you're dealing with multiple specialists, it can be a real jungle out there.
It can, and I learned that the hard way, trying to manage my mom's care across different doctors, different appointments, different treatments. It was a lot.
So how'd you keep it all straight?
Well, at first it was this giant binder, overflowing with notes and test results and appointment reminders. But it quickly became clear that wasn't sustainable.
Yeah, I can imagine.
So I had to evolve. I started using a digital system, something that could keep everything in one place, accessible, organized.
And that really speaks to a bigger issue in healthcare, right? This lack of seamless coordination.
Absolutely. And the research backs that up. Uncoordinated care, it leads to more complications, more errors, and ultimately higher costs.
Wow. So it really is a crucial piece of the puzzle.
It is, and I think the key takeaway here is that effective care coordination, whether it's through personal systems like I was using or through more integrated healthcare systems, it's essential for good outcomes, especially when multiple providers are involved.
And while we're talking about things that are essential, I think we have to address the elephant in the room, the financial impact of healthcare decisions.
Oh, for sure. That's a huge one. And it's where being proactive can really pay off, literally.
I remember a family member who, by really digging into their insurance claims, understanding their billing, and looking for assistance programs, they saved a ton of money.
And I had a similar experience. My brother, he managed to save over $12,000 on a hospital bill just by being informed and asking the right questions.
Wow, that's amazing.
It is, and it shows that these aren't just isolated cases. This is something that affects so many people. I mean, think about the fact that medical debt is a leading cause of bankruptcy in this country.
That's a sobering thought.
It is, and it highlights the fact that healthcare advocacy, it's not just about medical decisions, it's also about understanding the financial side, knowing your rights, and being proactive.
And along those lines of advocating for yourself, for your loved ones, I think we also need to talk about the emotional side of things.
Oh, absolutely. That's such a critical piece of the puzzle, the human element.
It is, and I've seen firsthand how being present, offering support during those tough diagnoses and treatments, it can make a world of difference.
And it's not just anecdotal. There's a lot of research showing that patients with strong support systems, they tend to recover faster, have better outcomes overall.
So it's not just about the medicine, it's about that human connection, that emotional support.
Exactly. It's recognizing that healing isn't just physical, it's emotional, it's mental, it's all interconnected.
And building on that idea of being an active participant in your healthcare,
Yeah.
I think we have to talk about the importance of research, of really understanding your treatment options.
Oh, absolutely. And this is where patients can really become empowered, taking ownership of their health journey.
So what does that look like in practice?
Well, I remember a situation with a family member who was dealing with a pretty complex condition, and they went above and beyond. They did their own research, found some innovative therapies that their doctor hadn't initially mentioned.
Wow, so they were really proactive.
They were, and it opened up new possibilities, new avenues for treatment, and I think that's the key takeaway here. With medical research advancing so rapidly, it's essential to stay informed, to explore all the options, even beyond what's initially presented.
It's about shifting from being a passive recipient of care to being an active participant in shaping your treatment plan.
Exactly. And that kind of leads into another important aspect, preventative care.
Oh, yes. The ounce of prevention is worth a pound of cure, right?
Exactly. And it's something I've really tried to emphasize within my own family, encouraging regular screenings, healthy lifestyle choices, those proactive steps that can make a huge difference long term.
And the data supports that, right? I mean, the CDC estimates that optimal use of preventive services could save over 100,000 lives every year.
It's a powerful reminder that our health journey, it's not just about reacting to illness, it's about actively taking steps to stay healthy in the first place.
And speaking of being proactive, one thing that often gets overlooked but is so important is the whole issue of medical records.
Oh, yes. Having a complete and accessible health history, that can be a lifesaver, literally.
It can. And I remember a story about a neighbor who had a medical emergency while traveling. And because they had their detailed medical history readily available, it made all the difference in the ER.
It's amazing how something like that, which we often take for granted, can be so crucial in those critical moments.
It really is. And it brings home the importance of keeping those records organized, up to date, and easily accessible, especially in case of emergencies.
And another aspect that we have to consider is the whole cultural piece, how cultural sensitivity plays into healthcare.
Oh, that's so important. Feeling understood and respected, it can make a world of difference in the whole experience.
Absolutely. And it goes beyond just feeling good. Research shows that culturally competent care leads to better outcomes, higher patient satisfaction.
So what does that look like in practice?
It's about recognizing and respecting individual values, beliefs, preferences, making sure that the care provided aligns with those cultural perspectives.
So it's about creating a truly patient-centered approach.
Exactly. And it's about recognizing that healthcare is not one size fits all. It needs to be tailored to the individual, to their cultural background, to their specific needs.
And one area where that individualized approach is especially crucial is during healthcare transitions.
Oh, for sure. That's a time when things can easily fall through the cracks, moving between different facilities, different providers.
And the statistics are pretty alarming, right? Something like 80% of serious medical errors involve miscommunication during those transitions.
It's a scary thought, and it really highlights why advocacy is so critical during those times to make sure information is shared to prevent those gaps in care.
It's about being that bridge, that advocate, to ensure a smooth and safe transition.
Exactly. And speaking of transitions, we also need to talk about the unique challenges faced by aging loved
Oh,
ones.
absolutely. That's a whole other layer of complexity.
It is, and it often involves finding that delicate balance between supporting their needs while also respecting their independence, their autonomy.
And as their health needs change, that balance can be really tough to maintain.
It can, and it requires a deep understanding, not just of their medical conditions, but also of their wishes, their preferences, their values.
So it's about advocating for them in a way that honors who they are, their whole person.
Exactly. And, as we're talking about navigating this complex world of healthcare, we can't ignore the role of technology.
Oh, for sure. It's changing everything, right?
It is, and it has the potential to be such a powerful tool for patient engagement, for communication, for access to information.
So things like health apps, online portals, all that stuff.
Exactly, and for many people, these tools are amazing. They can really empower patients to take control of their health.
But there's also a flip side to that, right?
There is, and we have to acknowledge that digital divide, the fact that not everyone has equal access or comfort with technology, especially older adults.
So it's about ensuring that technology enhances healthcare, not creates barriers.
Exactly, and it's about finding ways to bridge that gap to make sure everyone can benefit from these advancements.
And while we're talking about things that are essential for well-being, I think we need to shine a light on mental health.
Oh, absolutely. That's such a critical piece of the puzzle, and it often gets overlooked.
It does, and I think it's so important to advocate for psychological support for mental health services alongside physical treatments.
It's about recognizing that our mental and physical health are interconnected. You can't have one without the other.
And there's so much research now that shows the mind-body connection, how addressing mental health can improve physical health outcomes.
It's amazing, and yet mental health services are still so underutilized.
So what's the takeaway here? What do we do with that information?
I think it's about being aware, about advocating for mental health support for ourselves and for our loved ones, recognizing that it's just as important as physical health.
It's about a holistic view of health, treating the whole person, not just the symptoms.
Exactly. And our final point kind of brings everything full circle, this realization that the skills we develop as healthcare advocates, they have a ripple effect.
So it's not just about helping ourselves, it's about helping others.
Exactly. The knowledge, the confidence, the ability to navigate the system, those are transferable skills that can benefit our communities, our friends, our families.
It's about empowering others, about creating a more informed and engaged patient population.
And I think that's such a powerful message that our individual efforts, they can contribute to a bigger change, a more patient-centered healthcare system.
So as we wrap up this deep dive, reflecting on these 15 reasons, what's the core message for our listeners? What do we want them to walk away with?
I think the key takeaway is that being a healthcare advocate, it's not just about having information. It's about actively engaging, asking questions, speaking up, being a partner in your healthcare journey.
It's about taking ownership, right? It's about recognizing that you have a voice, that your perspective matters.
Exactly, and it's about empowering yourself to make informed decisions, to advocate for your needs, for the needs of those you care about.
And as you think about everything we've talked about, maybe pick one area that resonated with you as something you want to focus on.
Yeah, like maybe it's demystifying medical jargon or getting organized with your care or understanding your insurance better. What's one small step you can take this week to be a more active advocate?
And if you're looking for more information, for deeper dives into any of these topics, we've got a ton of resources on our website.
Yeah, we've compiled all the studies, reports, articles, everything that informed our discussion today.
You can find it all at theawakenstate.com under the resources section.
We encourage you to check it out, to keep exploring these ideas, and maybe even share your own experiences. We'd love to hear from you.
Thanks for joining us on this deep dive. We'll catch you next time.
See you then.